treatment summary and care plan and say, so has this affected your relationship or your sexuality or your intimacy? I have, seriously, like in 5 years, maybe 4 people gone, no, that's just fine. Everybody else is like, well, you know, or some people jump right in and say, yeah, it's decimated my relationship. I've ended up in a divorce. You know, it's 7 years since we've had sex. It's, you know, I have erectile dysfunction. I have vaginal dryness. I'm not interested in sex anymore. I'm interested, but nothing works. You know, I mean, all that kind of stuff. And seriously, I see multiple people a week. And in 5 years, I've had just a few people that have said, like, no, everything's great. and so I, you know, tout at the Cancer Center, let's ask our patients about this stuff. And of course, our oncologists are like, well, I can't fix that. I'm curing their cancer. And it's like, but at least we could ask the question. And we could offer it up and say, there might be something we could do. We could get you some couples counseling. We could get you some lube. We could send you to urology and see if we can fix the erectile dysfunction. We could give you some medicines. You know, there's things that we can do. And instead, we just don't talk about it. We just shove it under the rug, and we let people go on for 12 and 20 and 30 years after cancer, not having any sex, and ending up in divorces or relationships where you're on 2 separate sides of the house, and things like that, and we can do better than that. So, next time you go talk to your oncologist, you say, Leslie said, you need to ask me about this. But that's why I talk about this, and it's not, you know, I mean, it always makes us all blush a little bit and get a little shy and everything, and that's fine, but it doesn't mean that we shouldn't bring it up. So that's why I'm here, bringing it up. So, here we go. So, what are we talking about? We're talking about sex and cancer, and really those things don't go together so well, but unfortunately that's how we're built. And so, what happens though is a lot of times, you know, of course, when you're acutely sick and you just got a new cancer diagnosis, you're not going, now, how is that going to affect my sex life? Or, you know, it's like you got other things to think about, right? But then, here all this time's gone by, and it's like, we haven't talked about this for a year. And so there's 2 different things I'm going to talk about tonight, sex and sexuality. So sex is the actual, like, what you're doing. And the sexuality is that libido thing and the interest in the feelings and things like that. So cancer affects both of those. And one of the things that I tell patients a lot is, yeah, if you had the flu and you had a fever and you were achy and you were throwing up, you know, that isn't the time that somebody's going to go like, hey, come on, you know. And it's like, no, leave me alone, give me some fluids, let me sleep, right? But at some point, we've got to kind of go, okay, it's time to get talking about this. And really, when do you start talking about it? You start talking about it whenever you can. You know, as soon as you're not achy from having the flu anymore, then you say, hey, when should we have sex again? So right now, tonight, we're going to talk about it. So cancer affects the body. For folks who have had transplant, that's what that GVHD, that's graft versus host disease, that's what that is. So I know, and in this room we're talking prostate cancer specifically, yeah. Right? Okay. There may be other people who have had other things as well, but I'll try and keep this on the prostate end of things. But so if you see some of those words in there that you don't know, they may be related to other cancers, or you can ask me later. But certainly surgery, radiation, chemotherapy, and transplant affect our bodies all over the place. And low blood counts, when you're actually going through treatment, there can be risk of infection. Sometimes it's like, oh, don't have sex right now because you've got all this chemo coursing through your veins and we don't want you sharing that with anyone. Or your blood counts might be low and you might be at increased risk of infection, things like that. Also, some of the things that change during treatment can be just the body changes, sores in your mouth or feeling achy, things like that. But hopefully you get past that. Whoop. And then there's the changes that happen that tend to last. And like skin sensitivity. Some people, especially after radiation, they either get some numbness or they can get real hypersensitive in areas. Now with prostate cancer, if somebody's had radiation down around the rectum and the testicle area and in the low pelvis, certainly if things don't have any sensation or have too much sensation, that can affect how you're going to be feeling about sex. Pain, weight changes. Some people get really skinny and lose a lot of weight with their cancer treatment. Some people gain a lot of weight with their cancer treatment. Both of those certainly affect not only how you feel about your own body, but also how sensation is. Bowel and bladder function. I've had so many patients that have said, oh my gosh, I get some urination when I ejaculate, or I leak a little bit of stool now, and I never used to do that, and it's not very sexy. And I'll say, so if you talk to your partner about that, do they think that would be okay? And they're like, well, I haven't even mentioned it to them. I'd just be too embarrassed. And so then you haul in the partner and you say, so would it really bother you so much if there was a little urine leaking, or if there was a little bowel movement that was on a pad on the bed? And they're like, no, if I can get some nookie, I'm all for it. We can always wash up afterwards, right? And so sometimes our own embarrassment about changes in our own body can limit us, where we're just going to say, like, I'm not even going to bring it up. I might not be able to get an erection. I might not be able to ejaculate. I might leak some urine. So I'm just going to just say, let's go watch the football game, right? And we're not even going to give it a try. So that kind of thing. Oh, back up one more. And then there are the hormone changes too, and that's real. You end up having estrogen treatments to knock back the testosterone, and that's going to suppress that libido, and you're not going to, you'd so much rather go mow the lawn, right? But there are things that you can do that might be a lot of fun for your partner, even if that doesn't necessarily do it that much for you, but you might be making them happy. And that keeps a lot of peace in the hood, right? So, so this is a good thing. And go ahead and change over. There we are. And so there's all these different changes. Decreased desire, decreased arousal and orgasm, hormone changes, worry and fear and depression and relationship satisfaction. And then this whole role thing that's like the third one down there, that feeling like a patient instead of a lover. If somebody's been holding your head while you're throwing up, or putting, ointment on where your radiation burn was, or something like that, you're like, oh, I'm not feeling very sexy, right? But the thing is sometimes it's a matter of talking about that and saying, do you still think I'm pretty hot, even though we've been through all this stuff together? And for the most part, they're going to say yes. And if they say no, then talk about that and say why, and what could we do, and how could we get this back on the calendar and back in the bedroom and things like that. But talking about it makes a big difference. And I have to say that most, and no judgment here, but most relationships that don't make it through cancer probably weren't going to make it anyway, really, because if you're not communicating well and not willing to be through some adversity, it's kind of a matter of time anyhow. But there are things that we all have to do to work on our relationships, and one of the big ones is bringing things up and talking about them. You don't go, oh gee, we're just not going to talk about the mortgage. It's like at some point you got to go, crap, we got to talk about the mortgage. The thing is with sex, it's pretty easy to just never bring it up, and then that can create trouble. So partner changes, it takes two to tango, and a lot of the things that I hear from partners are, oh, I don't want to cause any pain. He's not asking for it, so I'm not going to ask for it. I'm kind of used to it not being a big deal. I'm just going to let it go. that kind of thing. Also stress, if I touch him, is it going to hurt something? That can also a fear of rejection. And that can be that if somebody's libido is kind of flat and they're like, I'm going to go mow the lawn and I'm going to go watch the football game and I'm going to go hang out and have coffee with my friends and I'm not going to tell you you look pretty in that dress or whatever. There's a thing like, well, if I ask for sex, am I just going to get told flat out no, that I'm not attractive anymore, that I've gotten old, that blah, blah, blah. And then so they just don't ask because they're afraid that they might get a no for an answer, too. So what do? You can bring up your worries and your fears and your concerns. And the best place to bring that up would be with your partner, right? So, honey, what do you think about this? You know, Leslie said we should talk about this. So, you know, let's pour a cup of coffee or a glass of wine and not turn the TV on and say, what do you think about all this stuff? So that's the best thing. But also you can ask your healthcare providers. You can ask the people in your support group. You can talk to folks and say, what happened with you? And how did you deal with this? Or are you avoiding it too? Right? And then there's also books and resources. And I did bring a couple tonight. I think I've got plenty for everybody. I did bring the American Cancer Society has a book called Sexuality for the Man with Cancer. It's got some pretty good information in it. It's a freebie from the American Cancer Society, but it's well written. And it gives you at least a place to start with this information. And then I brought one book that's my very favorite for men and cancer. It's called just Man, Cancer, Sex by a gal named Ann Katz. And she's a nurse and an educator up in Canada. And she has a whole clinic where all she does all day is talk about sex with cancer patients. And she's written a couple of terrific books. But this is maybe about $15 on Amazon. And it's called Man, Cancer, Sex by Ann Katz. And I've got it up here if people want to take a look at it later. But if you're not comfortable talking to somebody, then maybe looking at a resource like a book. And remembering that it's not always about the sex. We always think about, sex as being kind of that whole intercourse thing. You know, penises, vaginas, you know, mush, you make babies, all that good stuff, right? But there's so much more to it, right? There's romance, and there's intimacy, and there's sweetness, and there's all that stuff. And as we all get a little bit older, and maybe we've been with the same person for a pretty long time, that it isn't like we're first dating and having oodles and oodles of intercourse anymore. What we're doing is we're doing more snuggling and we're doing more cozy stuff. We're maybe holding hands. We're having those intimacies and those romantic things that may not actually be sex if you were to like write a porn novel or something. but those things also tend to fall off. If we think that we're not going to perform, we tend to just go that I'm just not going to do anything. But all of these things, looking through photos, talking about memories, looking at your wedding pictures together, doing even house projects together, as opposed to like, no, I'm going to do it by myself and don't come talk to me. Giving time for the romance and the intimacy to come back into the relationship can make a really huge difference, even if the intercourse doesn't come back, the coziness can. So, sex and sexuality, it's the same whether you're doing something with yourself or whether you're doing it with a partner. So if you're on your own, you can still practice at home. And the idea is our biggest sex organ does not have to do with whether or not our pants bulge. The biggest sex organ really is the brain. And we all know that little engine that could, I think I can from way back in our childhood. If you think you can, you probably can. At least do something. And so thinking ahead, imagining, making a plan. The big deal with that is not making too big of a plan, like, oh my gosh, now I'm going to be ripped and look like, some stud dude, and I'm going to be able to have sex all night long, and, you know, I'm going to be with this blonde babe, and you know, you have to actually imagine the reality. But imagine how it might go down. You know, would you want to have a romantic dinner? Would you want to like go off to a hotel room? Would you want to do something on a vacation? Or would you want to keep it kind of low-key and simple in case things didn't work so well? But think it through. Allow time not to feel rushed. A lot of times with my young parent cancer survivors, I tell them, don't try to do this 20 minutes before the kids get off the school bus. You know, you want time for things to go well or not go well and be able to process a little bit. And then let each time be its own time. And I have to say that let each time be its own time. How many times are we like, oh my gosh, I'll use tonight as an example, oh my gosh, I was all the way down there at that university place and I couldn't find my way anywhere, and so I'm never going back down there again, right? No, you know, you kind of go, okay, well, I got lost this time, but hey, now I know the area, right? So now I could come back again and I would kind of know where I was going. And I do think that we do that with sex a lot. It's like, oh, yeah, you know, I tried, but he said no, so I'm just going to not ask again. You know, or, oh, gee, I tried and I had problems getting an erection and I got embarrassed, and so I'm just not going to try again. But if we can say, okay, that was Thursday, and now we're going to move forward and it's 2 weeks from now on Wednesday, it can be completely different. But we have to suspend our memory and not drag that last time with us to this time. And be able to say, okay, clean slate, let's try it again. It didn't, you know, whatever I tried last time, maybe I'll try that again and it'll work. Or I tried that last time and I'm going to totally let that go and I'm going to try something different. And that letting each time be its own time and not dragging the crap from the last time forward with you is really important. So, set some ground rules. You know, saying like we're going to try something for half an hour, we're going to try something for an hour, we're going to try for 10 minutes, and if it doesn't work then we get to go watch the football game. Knowing that it's okay to laugh or cry or be frustrated or take a break and go get a glass of water and come back and retry again. Whatever your ground rules are, set them up a little bit so that there's actual communication happening. And really remember to have fun. And that's the thing. I mean, it's just if this is going off, you know, for your job and it's like, oh, drudgery, then that's not really what we're after. So touching yourself or guiding your partner to touch you in what feels good, and that has to do with those dull spots or those hypersensitive spots. To be able to say, you know what, that used to do it for me, but it doesn't anymore. So try this. And that's okay to do. It can be anywhere on the body. It can be an arm. It can be the inside of the thigh. If people like to have their shoulders rubbed, start there and then like move on, right? And then move to the more sensual or sexual touching as that feels comfortable and like you're ready to go. So this how to start. This lubricants can be really helpful. Being willing to go slow, check in, how's that feel, how's that feel? And really the tears and talking and negotiating and giggling is really okay. But I'm going to stop us at the lubricants for a minute because I do have this fun little box with me here today. So the basic lubes, and I've got a slide that's going to say this in a minute, but I'm going to start here. So the basic lubes, and I don't care what brand you use, so I've brought a few different brands just because they're ones that I know and I'm used to dealing with people. I've got samples, which means I'm going to pass them around, right? But lubes are kind of like wine. You know, there's white wine, and there's rosé, and there's red wine, right? And they go with different things. supposedly. I just say, you pour me a glass, I'll drink it, but that's okay. but the lubes go in with different things. So your basic water-based lube, you can't go wrong. You can use it with everything. It's your good cheap wine. You can buy it in a box, and you know, everybody likes it. And so your water-based lubes, the nice thing with those, they're slippery, but then they kind of wear away on their own. If you buy cheap lubes, you're going to get cheap results. So you do have to go a little above the KY jelly. Okay, don't just steal the KY jelly packets from the doctor's office. They don't work very well. They dry out quick, and they just don't have a whole lot of slip. They're there for one exam, and then they're done, and they're not really a lube. Then you can move into kind of a little more higher end on the water-based lubes, and they're going to be a little more slippery, have a little more holding power. Those might be our rosés. And then, you know, and then you can get into the silicones, and I'm going to send these around for you guys to try these. The silicones, you don't want to use with any sort of toys, with your silicone toys at all. Because silicone and silicone, who are my engineers in the room, silicone and silicone stick to each other and they form a bond. And they'll either ruin your toys or just get really sticky again. So you don't want to do that. So what I'm going to do, I'm going to send this around, and I want everybody to take a tissue or two and just run it around the room. And then we're going to follow that with a basic, we're going to follow this with a basic water-based lube. I'm going to start the other one on this side. And I would say don't put this on your hands until you get the tissue, unless you just want to play with it for a while. So what I want you to do with these is they're gonna kind of loop out like that. And just go ahead and take about a pea-size amount. And you can play with it, kind of roll it around in your fingers a little bit. I'm going to do it too, so I get to be, you don't get embarrassed as well. So now we'll go ahead and move on. So here we go. This is my slide that talks about with this, but you've gotten my intro now. So these water-based lubricants can be used with any toys. They can be used with condoms. They can. They're water-based, so they're going to just kind of disappear. If you rub it long enough, you're going to find that it dries out a little bit. You can always add a little bit more and kind of get it re-moistened up again. Some get sticky, some are scented, some are organic, all that kind of stuff, you know, which is great, you know, all for the organics. But what you'll find with these water-based ones, if you haven't wiped it off yet, is eventually it'll just kind of rub in and kind of goes away, okay? Then there's also some that are oil-based, and I'll send an oil-based one around in a minute. The oil-based can't be used with latex condoms. They'll break them down, just like, I don't know if you guys know this trick. It's one of my favorite tricks because I'm a camper. But if you put olive oil or vegetable oil on pitch, like if you get pitch on your tent or pitch on your pants if you're out cutting firewood, if you put oil on it, it will melt the pitch away and it'll make it go away. It's kind of a cool trick. But that's the same thing that happens with oil-based lubes on condoms. It disintegrates them, so you don't want to do that. So now that I've sent that one water-based one around, I'm going to send this one around too. This one is that one that's a little bit thicker, a little bit more slipperier. This is by a company called Sliquid. You gotta love it. And so do the same thing. Take about a pea-size amount of that one and rub it around. You'll notice that it's just a little. That one got warm in the car. We won't send that one around. You'll notice that it's maybe a little slicker. It sticks around a little bit longer. Then I'm going to do my oil-based one. And I just have one of these, so just take a little bit. This has a little bit more of an oil base. It's kind of a hybrid. It's got a little oil and a little water in it. But it's kind of a nice one, too. and then I'll send the silicone one around in just a minute. But we're kind of just getting a little more slippery as we go. So when would you use a water-based lube? You'd use a water-based lube for almost anything. You can use that to kind of slip and slide around a little bit. You can use it yourself with masturbation. You can, are you throwing my lubes? Wait a minute. But it can be nice it can also be nice for penetration, in that it does make things slipperier, and we're all getting to a certain age, so all of us, well, most of us females in here are getting more menopausal. You don't qualify for that, but you know, and just vaginal dryness is just something that happens after menopause. So having a nice, just easy water-based lube can be really nice for intercourse, but it can be nice for just rubbing and being slippery together, or hand use. The more thicker one, that pink one that I send around, the slipwood one, that one being a little bit, it has a little more oomph, a little more holding power. That might be one that if you know that it takes a little bit longer to get that erection, that one might be a good one to use, because then it's not going to kind of disappear as you're trying to manipulate that penis. It's not going to kind of, oh, now we got to add more, you know, and that one has a little bit more holding power. Both of those being water-based, if you get them on the bed sheets, it's no big deal. With the silicone one, it's, you know, you're just upping your game, and they're a lot more slippery. They're really fun and nice. You can't use them with silicone toys, and if you kind of goof and dump a bunch of it, it can make kind of like a oily stain on the sheets. So I usually say throw an old towel down or something. But I'm going to send these around. This comes out really fast. Do you hear that warning over there? This comes out really fast. You're just missing out on all this. You need to it should be coming back towards you, I'm hoping. These, to take a little dollop of it, it's just a little bit. And you'll see that if you rub that for a while, it'll rub until I'm done talking. It'll just keep going. This one is really nice, especially if, let's just imagine that intercourse isn't going to happen. We're not going to get that penis into a vagina. We're just going to be doing a lot of body slipping and sliding around. And that can be pretty hot and pretty sexy in of itself. But this, with that lasting power, it's not going to be like you're slipping and sliding around and then you're like, oh, you know, that hurts. Oh, don't pull it. You know, the silicone will last better. It's also great for manual therapy, for using hands. And the thing that people ask sometimes with the silicone is, and with the oil, well, is silicone and oil okay to get on, you know, our sensitive body parts? And these are products that are meant to go there. So they're not going to hurt the skin. They're not going to hurt a vagina. They're not going to, you can even get them in your eyes and they're not going to hurt you. I wouldn't put them in your eyes, but if you did, the other things, you know, good old hand lotion and Vaseline and essential oils and things like that. Some people can get away with that, and they do fine. But a lot of people have skin sensitivities, and especially after surgeries and radiations and things like that, the skin can be more sensitive. And I just don't tend to go there. But it doesn't mean you couldn't try it. Other things that can help. So before I move on to other things that can help, any comments about these lubes? Yeah.
Where do you buy that?
Where do you buy that? Great question. So many of these you can get online, and the #1 place that I recommend is that very first lube I send around that has the blue label, Babeland. It's called Babe Lube. And Babeland has a great variety of products. They're very reliable. They'll send things to you in a brown paper wrapper. and they've got a wide variety online. But Babeland is also local. They're up in Seattle area, if you want to go see them yourself. There's another place that's down in Portland that's called She Bop. She like girl and bop like bopping. So She Bop. They're terrific. But also if you just take the names of these down and Google them up, they'll come up for you as well. Good question.
Thank you.
Anybody else? Questions? Some things have a scent. I'm noticing you smelling that one. This one has a little bit of a pear scent to it.
Yeah.
And that's, you know, some people